Hi friends, I'm sure you must have seen people with epilepsy, those who are getting a convulsive seizures when you are walking around the street or in the town. It's quite a fearful sight. So if somebody is falling, making a cry or a loud sound and getting a convulsive movement with posturing of head, neck and frothing, tongue bite, urination. So the sight is is quite frightful. This condition called epilepsy. But you know that all those epileptic patients may not have the same picture. Some of them may have this sort of generalized fit. Some can have just staring, or some other they'll have a head turning or some rising sensation, visual feeling, sensory feeling, special memories, deja vu phenomenon. Many types are there. Hundreds of types of epilepsies are there. Basically, this is just abnormal excitation of the neurons in the brain. The brain gets hypersynchronously acting on its own due to some changes. This may be a idiopathic epilepsy. Idiopathic means where you don't find any cause, or this may be a cryptogenic where there must be a cause, or a symptomatic epilepsy where there is a known cause. Okay, like low sugar, low sodium, some brain disease, brain degeneration, infection, tumor, stroke, and many conditions depending on the age of the patient. This condition can occur from infancy, from the day the baby is born to hundreds of years, I mean the age of 100. But the cause are different. The cause in the baby or the newborn baby is different from the person who is around nearing his 100th anniversary. So basically the primary epilepsies are where the primary generalized epilepsy or absent epilepsy or a focal epilepsy. Focal epilepsy means there is a problem in the brain, one part of the brain is affected, or there is a generation of the epileptic focus from one part. Maybe there are multiple lobes in the brain, like a frontal lobe, you can have a temporal lobe, parietal lobe, occipital lobe, or the limbic system. So depending on the area of origination, the characteristic of the epilepsy or the epileptic for the aura can differ. There can be just a memory alteration, can be deja or jemaizu, or it can be you hearing a tone, you hearing a music, or experiencing a vision or something. So many out of body experience or visual hallucination, sensory hallucination, auditory hallucination. Recently I had a patient who experienced sort of a music. So I was wondering what this could be. His examination was perfectly normal. Then the investigation showed that he has got a lesion or a tumor in the temporal lobe. But those are rare. I just want to tell you that even people can come with they're hearing some noise or music also. So there are many there are types of epilepsy called a reflex epilepsy. When you watch the television, or when you're reading, when you are writing, when you are hearing something, or when you are exposed to sunlight or flickering light, or playing chess or doing arithmetics. There are all many types of reflexive epilepsies, or somebody touches you, or somebody makes a sound clap, you get a fall, called a startle epilepsy. So the epilepsy is a fascinating subject, fascinating field. It's a field of its own. It's a fascinating field. There's epileptology and neurology is a fascinating field. So how do you diagnose, or what is incidence of epilepsy in the world? It's been told that there are around 111 cases in India per lakh. Both genders are equally affected, both males and females. As I mentioned earlier, it can start from the infancy to the 100th year of age. So they can present in different ways. They can present the generalized fit, it can go to absent seizure, or it can be with a focal fit, or a dyscognitive or a behavioral abnormality, memory abnormality, psychic abnormality, sensory or special sensory. Many types, many subtypes of epilepsies are depending on the area of origin of the epileptic focus. So the best thing is the history is most important. This is followed by the investigation like blood calcium, as well as the sugar, sodium, potassium, sodium, magnesium and all. Then this has to be supplemented by electroencephalogram, or what we call as a EEG, electroencephalogram. So, this would tell you that there is a problem in the brain, there is some epileptic activity arising from either a general epilepsy or a partial or a focal epilepsy, or some various epilepsy syndromes. Then we can categorize those patients into different groups, and we can treat accordingly depending on what is the type of generalized epilepsy, or a focal epilepsy, or some other epileptic syndromes. Okay. So, we have lots of options of medication. We can treat with various medications, various newer medication with lesser side effect has come to the market. So, compared to the 1940s or 50s, where hardly there are one or two medication which would cause more of side effects, presently the latest medications are fairly better, and the side effect profile is much better. And we have medication which can be used in pregnancy with the least side effects. And we should, whenever a patient is getting pregnant, should counsel her to have a folic acid 6 months before conception, and should use a least a drug with the least side effect with adverse effect on the fetus. Like, many drugs are available that once you consult your doctor, they will tell you. And if 80% of the epilepsy, 70 to 80% of the epilepsies are treated with a single medication. If not, we can use 2, 3 or more medication. And if there are lesions or any damage to the brain, this can be removed or operated. Can have a temporal lobectomy, lesionectomy, or subcortical pile resection, subpile resection, corpus callosotomy. Many types of treatments are available. Then we have other option like a ketogenic diet, like you give less of carbohydrate, less rice and other things. Keep the calorie content from rice less than 400 kilocalorie per day, and use more of fat and proteins. That would reduce the chance of epilepsy by 50%. Then we have vagal nerve stimulation, we have responsive stimulation, we have deep brain stimulation. These are all available. So, you do not have to worry, better medications are available, surgical options are there, deep brain stimulation is there, vagal nerve stimulation is there, and other options are also available. And around 30% of the people can have a various psychosocial issues like depression, anxiety, irritability, autism, or attention deficit hyperactivity, or psychosis. So, you may have to treat all this person, otherwise they would not comply with your medication. So, a psychological assessment is important, as well as counseling is also important part of the treatment program. Then additionally, there are so many misconceptions regarding, like, when the patient is on the floor getting a seizure, putting something into the mouth or giving some keys or something in their hand. Actually, these are baseless, without any scientific basis. So, better if the patient is seizing, do not do anything. If at all, what you have to do is you release his buttons or the buckles of the pants and all, so that he should not strangulate by himself. You remove his ties and all. That is the only thing what is required. And if the seizure lasts longer than 2 minutes, immediately take the patient to the hospital and get the immediate treatment. Because usually what happens is they get a fit, and this will be followed by, they'll lapse into a stupor or a sleep for 15 to 30 minutes. So, if the seizure, this motor activity lasts more than 2 minutes, immediately take the patient. And if the patient is already getting a fit, that is a known case of epilepsy, there may be medication which can be given into the mouth or to the rectal, called an intranasal midazolam or rectal diazepam is also available for those patients who are also already known epileptic. So, the most important factor I want to tell you is that epilepsy is largely treatable, and we have so many better medications available. A combination medication is also available, and we have to find out what is the epilepsy types. Depending on the type, we have to tailor the medication depending on the cause of the epilepsy, depending on the type of epilepsy, depending on the syndromic diagnosis, and the age, and various whether the patient obese, whether the patient has got a reproductive age group, whether the patient elderly, whether there is any psychiatric comorbidity, whether it is a diabetic, or any other factors are involved. So, we have to give the medication accordingly, and they should strictly adhere to the medication and continue the medication for the stipulated time. That may be 2 or 3 years for a patient, but it can vary depending on the basic underlying pathology. Okay, so epilepsy can be treated, and should tell that they can have a normal life, they can have a normal married life, can have children, and the chance of getting a problem in the next generation is hardly limited, very few in number. And the problem with the medication related side effect of the feet is also hardly 4% compared to 2% in the population. So I don't think it's a major factor, and but always try to take a folic acid beforehand, before 6 months before getting conceived. Okay, so if you have any questions or comments, you are free to do so. Thank you very much.